sometimes we see patients that really want to have an improvement of their appearance. They might be in their 40s, 50s, 60s, and they may feel like they look about a decade older than they actually are. What I do is start my initial assessment and I ask them what their main concerns are, and then I kind of work backwards. Sometimes people allow me to kind of say, well, what do you think? And I think it's important to kind of start from the outside in. So when people ask me what can I do, then I say, well, you know, simple good skincare can really work wonders. A good sunscreen, staying out of the sun, eating healthy, those are all things that we should all be doing. But beyond skincare, then we start working our way down. And this is when we start talking about layering. So layering might be where we do chemical peels and things like that for brightening skin. And then we start talking about lasers. We have the Clear and Brilliant laser, which is really minimal downtime, really kind of almost a lunchtime type of laser that we can use for brightening skin, improving tone and texture. It is really a nice laser. Beyond that, we start looking at like, well, what does the skin look like as far as like color? Are there more browns? Are there more reds? And that's when we start talking about our Zeo Limelight machine, which is our intense pulse light or IPL machine. We can kind of target those areas to kind of lift them in improvement. And then we can also work on the vessels as well on the face. So keep in mind that this is kind of a maintenance thing. You might continue to grow some new weeds as you continue to age. So sometimes people have to maintain them, or they kind of hit them a little bit harder at first and then just do some good maintenance kind of long term. So now we're working our way down into the skin, and then we start talking about fillers and Botox. So for Botox, it's FDA approved for the glabella region and also the crow's feet, but we use it off-label as well. And it basically can kind of help prevent that frown line right through that area. We call those the 11s. It can kind of lift the brow as well. It can really be a nice adjunct to everything else that we do. It'll last about 3 months or so, and you might want to do repeated treatments. And if you do that by about 19 months, you'll start to get some permanence. Beyond that, for little crevices or wrinkles and things like that, we start talking about hyaluronic acids. So hyaluronic acids would be like Bolotero for the tear trough. We might consider Voluma or Restylane Lift for the cheeks. Juvederm, Restylane for nasolabial folds, which is this area here. We might consider some fullness for the lips and might consider some Restylane or something like that. So we're kind of adding some volume to the face. Sometimes people want to, you know, they feel like their face is just globally deflated. And in that instance, we might want to consider Sculptra. So Sculptra's polylactic acid is the same thing that sutures are made out of, and it's kind of micronized or milky. And we basically put it into the skin, and it's infused using needles. And then over the course of the next couple months, your body creates this collagen response, and people call it the Sculptra glow. We like to add it to the temples and kind of rounding of the face. It's the kind of thing that it's so subtle, people will say, gosh, she looks really good, but nobody really knows what she's had done. And that's the exact type of response that we would like. So we've added some volume, we've worked through different things as well. And then as we go deeper, you might also consider doing Ultherapy. So Ultherapy is FDA approved for brow, face, and neck lift, and that's really nice as well for kind of lifting those areas. It's not exactly a skin tightener, but it can help with lifting those deeper areas. So when we think of patients, we try to kind of start from the outside, work our way in, and do some of that layering. And people have all, you know, different budgets. They have different ability to take time off work. We have an amazing Smart Skin CO2 laser, which is a fractionated laser, which has a little bit more downtime. But if you can't do that, then you might consider a series with Clear and Brilliant. So I think now, more than ever, we're able to customize to patients, and I think it's really important for them to know that it's not just a one-stamp, you know, kind of treatment, that we're really critically going to look at a patient every time they come in and then decide what is best for them. So in essence, I think that layering is probably really important. Our goal is to create a natural beauty with harmony and not to have too many areas that are too full. You want to have some lift, you want to have some vibrancy, you want to have some clarity of skin. So I think all these things are pretty easily achievable.